So my name is Nicole Boyce. I'm the founder of Global Genes and the Chief Mission Officer. And welcome to this year's Health Equity Forum. You know, when I was asked to open up this event, I kept thinking about, what are some of those kind of organizational goals that we are super committed to and that are bold. And I wanted to share them with you because we talk about this a lot as we're bringing people in and, trying to create new champions for the work that we're all doing in rare disease and what these kind of these beliefs are. And so I'm gonna say them to you because I think it's super relevant for this conference. So we as an organization, and I know as a community, can all align with these. We all have these bold goals where every person should have access and be able to get a diagnosis so that they can get answers. Every person deserves access to extraordinary care. Every person deserves access and the ability to access treatments and therapies that can help them thrive and flourish. So we as an organization move forward with that mindset, right? How can we help be a part of that to ensure that we can remove barriers to some of the important work, treatment, care, support is available to all. And, with that, even over the years with these events, Global Genes has always tried to remove barriers to access to educational tools and these conferences. We've always gone above and beyond to try to find, ways to help support travel so that, it doesn't become a financial burden. And we know it's gotten harder over the years. But we are committed to you all and to this community to try to make this the opportunities for us to gather and learn as accessible as possible. We have extraordinary partners. Our partner, the Rare Disease Diversity Coalition, is here, and others. We have programming like All in Rare, this amazing event where we all try to come together to start tackling some of the challenges that we have around diversity, equity, and inclusion in our ecosystem. And we are committed as an organization to be open and inclusive always. And I hope that you feel that when you come here, that we are one big family and have a lot of amazing people that all have extraordinary backgrounds that hopefully you've all been able to get to know. We are also very intentional, and I remember learning this from Tanisha Washington, who you'll meet in a second, when we were starting to work on programs. And she said, Nicole, this isn't just about us, telling people that we want to learn. It's creating environments for bidirectional learning, right? Like, what can we learn from you, and then what can we give back? And it becomes this really great kind of bidirectional, lovely relationship where we all grow and learn together. And so I'm so grateful for that comment. So without further ado, we have an extraordinary agenda today. We have amazing speakers, and just want to welcome everyone to the day. Let's make this is a lot more interactive, and let's just make it a place for authenticity, for, like we said this past week, for authenticity and vulnerability, and let's be real, because that's how we learn. So without further ado, I'd like to introduce my amazing colleague, Dr. Tanisha Washington, who leads a lot of our DEI work here at Global Genes, and she's today's forum host. Tanisha?
Good morning, good morning. As I always start off everything with how excited I am. So I said this morning that I will try to limit my word of excitement, use of excitement, even though I'm going to continue to say it. So first off, I want to take us back. So Global Genes team, I got here on Tuesday, and I know there were so many other people that got here probably Sunday, who knows. So hand clap to my colleagues who have been around this entire facility doing a lot of things behind the scenes. So I want to shout out to Global Genes and colleagues for putting on a great function all week. And then I also want to say to the great AV team, I don't know if you've been in these little side rooms, but the music that's been playing, I did not follow directions this morning. I wore a dress when I was supposed to wear something with pockets, and they still made it work. So if you see me holding this in my hand, that's why. So shout out to AV team and just the hotel. It's been beautiful. Everything that's been needed has been given. I think his name is Paul. I was walking around, I was lost. And I was like, Paul, I'm looking for this room. And he was like, Tanisha, it's right there. So I just want to start off by saying that. And I also want to say that I serve as the diversity, equity, and inclusion lead here at Global Genes. And I'll give you some background really quickly about how I ended up in the rare disease space. So years ago, who's been in rare disease for about 6, 7, 8 years now? Raise your hand. So I started working for an organization, and I actually, Nicole probably doesn't remember this, I was going to different functions, and I actually was at a Global Genes function. And the many functions that I had been to, people used to walk up to me and say, oh, hi, Tanisha, you must be Tanisha. And it was because I usually was the only Black woman in the room, and of course, let's be real, Tanisha and Black woman. So they used to walk up to me and say, hey, you must be Tanisha. And at some point I was like, oh my goodness, I do love the rare disease space, but I want something to be different. This doesn't have to be this way. And so I laughed with some people earlier this week about how you just don't understand how it used to be and where we are today. So to see the different groups of individuals in the room, and I'm always honored to see that, because this is a process years ago that Nicole and I got on a call and we said, hey, we're gonna do something different. And to see this happening and to see us all here today is just phenomenal to me, and it's always surreal for me to see different faces in the space that used to not, in my opinion, be different spaces. So we've made our strides. And I don't wanna, although health equity is at the end of this week, right? I wanna be clear that everything that we do in Global Genes, and I hope you've seen this throughout the week, that we've weaved health equity through everything that we do. I've heard about kidneys being given away. I've heard about 5-year-olds started writing books. And I hope that you've taken some of those lessons and you'll also take some of that work today as you learn about the different things that we'll discuss. Global Genes is not the only group that's doing health equity work, for sure. And we hope to be a leading organization for you all to ask questions about that. But I also want to be sure to say we have panels and excellent experts that are going to be here to talk about their work as well, and how not only where we are today with health equity, but I hope that we can continue to bridge that gap, because we aren't where we need to be, but we will and we can be there at some point. So with all of that, I would love to introduce somebody that we were just walking around. We ended up walking into Michele yesterday. Our actually speaker today, Michele Wright, who is the co-founder and executive director of the National Organization of African Americans with Cystic Fibrosis. Throughout her career as an innovator, educator, entrepreneur, creative senior executive, nonprofit leader, mentor, advocate, oh my, Michele, she has earned numerous accolades for her profound commitment to highlighting and driving diversity, inclusion, and health equity, and making a positive impact for children, women, and underrepresented populations worldwide. Please welcome Michele.
Thank you so much for that introduction. I need you all to do me a favor. First of all, can you all hear me? Can you all say, Michele, breathe? You breathe. Thank you so much. It's such an honor to be here. Thank you for that beautiful introduction. You look gorgeous in the dress. It's so refreshing to see organizations not afraid to embrace diversity, equity, and inclusion. Because if no one else gets the memo, none of us would be here if it were not for diversity, equity, and inclusion. So give yourself a round of applause. Now that was the practice. Make it a little more exciting than that. There you go. I'm so appreciative to Global Genes because to me, Global Genes always takes the lead and sets that level of excellence for everyone else to follow. So I am so glad to be here. I am not Mike, so I'm going to try to maneuver this from the podium, but I think we can make it work. You have already been introduced to me. I am Michele with one L, so that's kind of rare in itself. And I'm talking today about living rare within rare. So, who am I? I am a woman that wears a lot of hats. I have been in a lot of fields. I've done a lot of jobs from selling biscuits to engineering to health equity. And with every single one of them, I've learned the value of working with others to make a difference, and to make a difference for not only today, but for generations to come. So it's interesting to talk about the subject, rare within rare. I have a question for you. Is being rare a good thing or a bad thing? Good? Okay, because we always talk about being uniquely rare, and I just to let each of you know, I want you to look around the room, and if you do not see another you, you are rare. You are unique. So I think I heard good. Some good categories of rare I think of: a rare diamond, a rare car. How about a rare painting? I think we will all love the Mona Lisa. But there's another coin to that, another side to that coin, and which is why we're here. A rare disease, a rare mutation, a rare form of cancer. There are some things that may be rare is not so good, being one of those rare persons that get chosen by the IRS for an audit. So I think, okay, maybe I'm having flashbacks, but we're gonna get through it. So I would say it kind of depends. Is it a good thing or a bad thing? So what is rare? Rare is uncommon. How many of you all saw the total eclipse this year? Okay, a pretty rare phenomenon, I would say. Unique, the albino tiger is rare and unique. Beautiful to see. Unusually great, and you all can clap for this one, like Global Genes. And again, like I mentioned, one of a kind, each and every one of you. That's why I just love sometimes watching people. I was at the reception last night. I kind of snuck in, don't tell anybody. And I just like to watch the way different people for different walks of life communicate, and what they choose to eat, how they choose to dress. That is always something so beautiful to me, and not occurring very often, such as a rare genetic disorder. So, as mentioned, I am the co-founder of the National Organization of African American with Cystic Fibrosis. And the acronym, just in case you're interested, is pronounced Know Self. Like know yourself, know a self. And again, I want to give special thanks to Global Genes and the 2024 Rare Advocacy Summit, because when I think about it, this topic may be rare, but they had so many people they could have chosen from to be here to speak today. And so I do not take this opportunity for granted. So I am just thankful and grateful to be here. If you weren't Black, and I appreciate the doctor getting up here expressing how it used to be compared to how it is now. But as she said, we still have a long ways to go. When I stepped away from engineering after several years, I decided to invest 15 years in pharmaceuticals in the biotechnology field. And fortunately, as a pharmaceutical specialist, you learn about different disease states, a lot of them rare diseases, and different signs and symptoms. So when I met my husband, it was on November the 1st, 1999. And when I tell you, it was love at first sight for him. And, and so, you know, it was pretty amazing. But I noticed a few things weird about him. I noticed he would eat and run to the restroom. He would drink and throw it up. And he was going to the emergency room about once a week. And I said, you know, I don't know what's going on, but maybe I need to not answer his phone calls anymore. But I did. I continued talking to him. And one time he came over, he said, my chest hurts. And he kind of described the signs and symptoms. And I said, that sounds a lot like pneumonia, but let's just rule it out. Actually, I saw a quinolone at that time, antibiotic for pneumonia. So I said, let's just rule it out. And so he went to a clinic about 2 blocks, literally, from my home. And the doctor during that time, that was early 2000, said if you weren't Black, I would say you had cystic fibrosis. Well, that was the first time either of us heard of cystic fibrosis, and would become another 17 years for us to hear the word cystic fibrosis again. And those words, if you weren't Black, will come back and haunt us. So one of the things that's interesting to me is to talk of newborn screening. And I'm going to get back to the story. But I talk to a lot of people that say, well, it's unfortunate your husband didn't have newborn screening during that time. That would have made a difference. Well, actually, it wouldn't have made a difference, because a lot of the newborn screening focuses on delta F508. And guess what? Typically, a lot of BIPOC individuals have rare mutations. And if you have rare mutations, a lot of times you don't qualify for different therapeutic medicines. Not to mention, those rare variants are usually not included on newborn screening. So actually, it wouldn't have made a difference. My husband, by the way, turned 62 years old this year. Is there anybody in the audience that has cystic fibrosis? I'm curious. Is there anybody in the audience who have dealt with anybody with cystic fibrosis? Okay. I think you all can attest to making it to the age 62 is kind of unbelievable. Matter of fact, we are shocked when we tell people Terry's story for one or two reasons: for him to be Black with CF and for him to be old with CF. And I know 62 is not old, trust me. I know firsthand. So that is one of the reasons I have advocated in our organization for Terry Wright's Law, because we want to improve diagnostic equity in cystic fibrosis newborn screening. Because in most states, as it says up here, a limited panel of variants, such as L508 delta, which is one of greater than 2,000 different types of variants in the CF gene are tested, a very limited variable. Actually, in the state of Mississippi, it's the only variant tested unless something has recently changed. So this law will require that all known CF causing gene variants be evaluated and diagnostic testing be done for all individuals with cystic fibrosis. I think before I go forward, I want to go back and tell you more of my story with my husband, Terry. So I mentioned how Terry would go to the hospital weekly, and he would go for the special cocktail of Demerol and Phenergan. He'll eat, he'll get sick, he's in extreme pain. And keep in mind, for years, he was told, you know, he spent a lot of years hospitalized at the Children's Hospital. They say you have a bad stomach, you have an ulcer, you have asthma. Once I got involved, it was interesting because it went from those things to saying, are you an alcoholic? Your pancreas is so, I mean, in some of the worst shape I've ever seen. My husband didn't drink. And so in 2000, he decided to have an 8-hour pancreaticojejunostomy to give him relief with his pancreas. So he's unique. Not only did he have it impact his GI system, but his lungs. He had chronic pneumonia, bronchitis, sinusitis, you name it, he had it. So doing the surgery, it's like the closest I can say, the Whipple. He learned about something so simple called enzymes. And something that small makes such a significant difference. Can you imagine if someone would have just said, try these enzymes earlier in his life? How much of a quality of life we could have had. My husband spent our honeymoon in the emergency room. And so he did that, but he still continued to suffer and get worse. He wasn't getting better. I remember one time he asked the doctor, why do I constantly, fortunately for him, he was an athlete. He would do these 100-mile bike rides, run marathons, climb mountains. He said, I can improve my game if you can help me prevent all this salt from covering my body. And the doctor said, now keep in mind, if you look at the signs and symptoms of cystic fibrosis, he was the walking poster child. He had all the symptoms, especially the salt. They would say, you just dehydrated, drink more water. And so usually when he would go into the hospital, they would give him high-power antibiotics. They would keep him there a few weeks. They would treat the signs and, whatever he was dealing with, signs and symptoms. And he'll come home for a few months, and then we start the cycle over again. But something unique happened towards the end of 2016. He was in the hospital all the way through Christmas and all the way through New Year's into 2017. And this time, instead of getting better, he got worse and worse and worse. And the doctors could not explain why. And I said, sometimes it's amazing you have to step back to regroup, and sometimes the answer or access to the answer is in front of you the whole time. I said, what am I missing? And I try to reflect back to my pharmaceutical days. And I remember something. If no one else could usually solve a mystery, the infectious disease doctor could. During the time I called on infectious disease doctors, it was only a handful in the state. So I decided to call the place I knew would probably have the best chance of having one, and that was UAMS, the University of Arkansas for medical sciences. I said, by chance, do you have an infectious disease doctor on staff? They said, not only do we have an infectious disease doctor on staff, we have an entire department. I said, my husband is not doing well. He hasn't been doing well since I've known him for the last 17 years. And to be honest, unless we get ulcers, I don't think he's going to live to see 2018. We went to that appointment, and the first thing they said, we know you are Black, but you have the signs and symptoms of cystic fibrosis. Well, we looked at each other because remember 17 years, we heard the word cystic fibrosis for the first time. They said, we're going to send you to Children's Hospital to do a sweat chloride test. And I said, you know, I'm not trying to challenge your authority. Don't you think he's a little too old for Children's Hospital? And they said, well, usually you are diagnosed as a child, and they're the ones to do the test. So he went to Children's Hospital. They did the test, and lo and behold, he was diagnosed with cystic fibrosis. They didn't believe it, so they sent it to Johns Hopkins to confirm, and it was confirmed. He has cystic fibrosis. And that is one of the reasons we wrote the Wright cystic fibrosis screening tool, because we want to make sure that no one is not diagnosed based on assumptions, based on stereotypes, based on people's beliefs that cystic fibrosis or any rare disease belongs to any particular race, ethnicity, or background. And so that's why we do what we do today. I mean, my husband has written a coloring book. We do an annual biomerge conference, Blacks, Indigenous, and other minority ethnicities with rare genetic diseases. We have been featured. We even wrote a documentary, and maybe one day Global Genes can share it with you. But I do want to leave this with you. Regardless of whatever your unique position or rare title that you hold, make sure you do all you can do to make a difference in helping to get every single person, without exception, diagnosed and the medical treatment they deserve, because health equity should not be a rule. No, I'm sorry, it should not be the unique exception, it should be a rule. And I thank you for your time and really appreciate you coming to listen to me today. Thank you.